Hello, everyone. This is Dr. Mike. We're back here for tip number 36 in our Medical Exercise Training 101 tips series. Now, this tip is going to look at something that we found was occurring quite often in the late 1990s and into the early 2000s. That was health clubs trying to establish cardiac rehab programs when cardiac rehab programs in hospital or clinical settings fail. So, if you would, let me read tip 36. I own a large health club. Is a cardiac rehab program a smart program to develop to establish a bridge to the medical community and referrals? Now, again, we saw numerous cardiac rehab programs across North America failing. The reason, the reimbursement they were receiving for their services were so low and so meager, hospitals couldn't justify these programs anymore and they had to shut them down. Now, in a cardiac rehab program, you normally have to have cardiac trained nurses. You'll have to have telemetry equipment, the medications, the drugs, the treadmills, everything else. And this is going to be a very expensive undertaking that was reimbursed at very low levels. So please, if you would, let me read the tip. Excuse me. You have to understand the environment out there in cardiac rehab. Cardiac rehab is actually on the decline. And folks, at this point, it is at an extremely low level compared to what we saw at the end of the 20th century. If you notice, many hospitals have discontinued cardiac rehab programs. The reimbursement for cardiac rehab is minimal. Medicare and other insurance carriers have reduced their reimbursement to the point cardiac rehab programs are losing money, or they lost a significant amount of money. So first, determine if a cardiac rehab program in your facility would be a revenue generator. Yes, it may attract referrals, but will the referred clients have the ability to pay for the sessions in your club membership? Also, cardiac rehab programs required a licensed registered nurse or RN with cardiac rehab experience. You must have a telemetry machine to monitor the client's cardiac response to exercise. You also must have a crash cart with the appropriate drugs and medication. The cardiac rehab nurse will administer the drugs in an emergency. Maintaining the cardiac rehab nurse telemetry and crash cart can be a pretty expensive process, but reimbursement is at minimal levels. So I recommend a program with those clients who finish cardiac rehab. These are stage 3 and 4 clients. They can come to your facility, but they are medically stable. They don't require a cardiac rehab nurse, the crash cart, or telemetry. They can be your bridge. I don't think establishing a cardiac rehab program is your best option. Establishing an MET program that can manage stage 3 and 4 cardiac rehab clients is the direction you want to go in. It was kind of interesting. There was a period of time where everyone thought cardiac rehab was medical exercise training and post-rehab. Folks, we found, quite honestly, in our physical therapy practices, cardiac rehab, there was a great need, but it wasn't reimbursed at reasonable levels that allowed it to be sustainable. Now, please don't get me wrong. It's not all about the money, but it is if you're in a fitness setting and you're adding this additional service, excuse me, is it a service that you can maintain based on the revenue that you'll bring in and the need to provide the staffing? Finding a cardiac rehab nurse is not very easy then, nor is it easy now. Let me conclude with the last paragraph here. As I mentioned, Medicare covers many cardiac rehab clients. Some are on fixed or limited incomes. You may want to establish a group rate to make the program affordable for them. This isn't a cardiac rehab program, but this is an aftercare program. So they finish cardiac rehab program. They're now coming in for group-based exercise that's much more affordable for them. And with that said, what types of clients do you want to attract to your facility? Do you want cardiac rehab clients or orthopedic-based clients or even neurologic clients? You may find that orthopedic-based clients is a better fit for your facility. They may use more one-on-one MET services and group-based training. The cardiac rehab client will certainly have orthopedic issues, but I think possibly going after the orthopedic-based client gives you many more options for establishing referral relationships with physical therapists, chiropractors, and orthopedic surgeons, as well as general practitioners, neurologists, and others. Appoint an MET or post-rehab manager. If you're a club owner, appoint someone to be the manager that's not a physical therapist or a chiropractor and not a management person, but a staff member, a fitness staff member that has some experience working in a rehab setting. This should be someone with a background in rehab as a rehab technician, as I said, and for someone who also has our medical exercise specialist certification. You may want to offer more flexibility with memberships for clients coming in by referral from physicians and therapists. This is one thing we found several years ago that was very difficult. Clients would be referred by a physician for exercise, but the health club owner was very strict and stringent in that they had to purchase a membership. Folks, these are individuals that may not be in your club for long periods of time, not because of any issues with longevity, but just simply from the standpoint they may not only need your services for a period of time. So opening up your club or offering a special medical membership really does allow you to establish that bridge to the medical community rather than having a buffer and a barrier there with having to purchase a membership. The rapport you can establish with medical professionals and their patients is far more than your membership policies that scare away clients that have been referred. So the most important thing here is, as a health club owner, be flexible. Clients that are coming with medical needs, they need a little bit more flexibility to come in. In some instances, especially with our senior clients, they may be on fixed incomes. So it requires a little bit more flexibility, but also to personal trainer managers. You may not see large packages purchased by these clients. They may go one session at a time, 2 sessions at a time to see the progress, but what we will get out of it on the back end are more referrals from the medical community, which may lend itself to a higher credibility and more of a referral relationship with the medical community. So please, if you would, go over to MET101ebook.com, download a copy of our free MET101 ebook. Along with that, if you have questions for me, particularly on, as a gym owner, utilizing or developing a cardiac rehab program or for some other method of establishing that bridge between your facility and the healthcare community, please contact me at drmike@postrehab.com. So thank you again for watching. All the best, and we'll see you in tip number 37.